As a cat owner, you might be missing critical signs that your beloved feline is in pain. Vets have identified 7 subtle red flags every owner should know. We are diving into the hidden world of cat pain, where instinct forces them to suffer in silence. The tragic story of Ginger shows how easily subtle signs are missed. Her owner, Karen, thought everything was fine until Ginger's pain became critical.
Cats are biologically programmed to hide their pain. In the wild, showing weakness means becoming prey. This ancient instinct is wired into their DNA. Pain is a private emergency for cats. By the time they truly cannot conceal it, the situation is often already critical. Early detection is everything.
Veterinary professionals have identified 7 specific, subtle signs that are most commonly missed. We are going to go through all of them. The first sign is a change in grooming habits. Cats spend up to 50% of their waking hours grooming, so any shift is a message. Cats in pain often stop grooming areas that hurt, leading to dull, matted patches, especially near the base of the tail if they have lower spine arthritis.
Conversely, some cats overgroom one spot due to misfiring nerves. Licking interrupts the pain signal, leading to hair loss or raw skin as a coping mechanism.
The second sign is an altered facial expression, which can be hard to notice but is clinically measurable. Veterinarians use the Feline Grimace Scale, which measures 5 cues: the position of the ears, eye opening, muzzle tension, whisker position, and head carriage.
A cat in pain will show slightly flattened ears, a tense squint, whiskers pulled back close to the face, and a slightly dropped head. Look closely at their face today.
The third crucial sign is a change in their established social behavior. This is a massive red flag. A social cat that starts hiding under the bed or no longer meets you at the door is telling you they need self-protection. Pain makes people and movement unpredictable and risky. If your cat flinches when touched or stops jumping onto the couch, it's not forgetfulness. The movement or interaction has simply become something that costs too much. Never assume withdrawal is just getting old. Over 90% of cats over age 12 have radiographic evidence of arthritis. Old age is not pain, and pain is treatable. Understanding these subtle signs can drastically change your cat's quality of life. Don't wait until the situation is critical. You must become the detective. Pay close attention to what changed, when it changed, and how long it has been changing. Your cat is relying on you. Are you missing the subtle signs your cat is giving you about their health? We're diving into the red flags that live in plain sight. Veterinarians often say the litter box is the most important diagnostic tool in your home. It reveals more about your cat's health than almost anything else. Let's start with the fourth red flag, a change in litter box behavior. A cat missing the box is often mistaken for a behavioral problem. Owners get frustrated, thinking the cat is acting out, but there's usually a physical reason.
Consider arthritis. A cat with hip or knee pain finds stepping over the litter box edge excruciating. They may plant their front feet in, but leave their back end hanging over to avoid the jolt of pain. Urgency and avoidance, like going outside the box, can signal a urinary tract infection, bladder inflammation, or kidney disease. The cat associates the pain of urination with the box itself. If your cat is suddenly visiting the box much more often, but producing very little, or straining and crying out, this is an emergency. It could indicate a life-threatening urinary blockage, especially in male cats. The fifth red flag involves vocalization patterns. How your cat talks or stops talking is a key signal many owners miss. While healthy cats meow for communication, cats in pain may make small, odd sounds, a low groan when shifting, a brief cry when jumping, or soft, prolonged vocalizations in the quiet of the night. A chatty cat suddenly going quiet might not just be calmer. They might be conserving energy, redirecting resources toward managing pain. Playfulness and vocal engagement are often the first non-essential things to shut down.
Next, the sixth red flag, changes in posture and movement. This requires you to become a careful observer, even when your cat is resting. A cat in comfort rests in a relaxed loaf position or fully stretched out. A cat in pain rests differently, often tucked more tightly or with a slightly hunched back to protect a sensitive area. Watch their movement. Do they hesitate before jumping? Are they avoiding heights they once managed easily or taking longer routes? These are workarounds to minimize pain. Finally, the seventh red flag, a change in appetite and eating behavior. This is often one of the last signs to appear, but the subtler changes are still worth tracking. Dental pain is common. A cat with a painful tooth may favor one side of their mouth, drop food, or eat slowly. They may suddenly prefer soft foods over hard kibble, which is an adaptation, not just pickiness. Nausea from kidney or liver disease can cause a subtle, inconsistent decrease in appetite. If your cat seems slightly less interested in food, don't dismiss it as boredom or stress. Track it consistently. Noticing these subtle signs changes everything. If you see persistent changes in litter box use, vocalization, posture, or appetite, consult your veterinarian right away. Feline pain. What comes next and the cost of waiting. This is essential information for every cat owner. We are going to discuss how time is a critical, measurable factor in managing your cat's health and pain. Time is not just an abstract concept. It's a real factor determining the outcome for your cat, or any cat you love. Veterinary medicine has profoundly changed. Tools like X-rays, ultrasound, and blood panels are better than ever for diagnosing pain. The cruelest part of feline pain is not that it's hidden, but that it's treatable. None of the modern treatments work on pain that no one knows is happening. In many cases, feline pain is dramatically, life-changingly treatable with modern medications, joint supplements, and specialized procedures. Proper pain management can return a quietly suffering cat to a quality of life that looks genuinely different, with more movement, engagement, and appetite. That quieter, more distant version of your cat is not just getting old. That version is likely a cat in pain, and it's not the real cat you fell in love with. Karen, the owner of a tabby named Ginger, found this out. After aggressive treatment, commitment to medication, and follow-ups, Ginger was transformed in just 6 weeks. So what can you do now? Start with documentation, the most practical and underused tool for cat owners. Take videos of your cat's normal daily activities: getting up, walking, jumping, eating, and using the litter box. Be sure to date these videos. Videos provide your vet with extraordinary context and a baseline, transforming a vague, something is off feeling into concrete clinical data by showing changes over time. Next, overcome hesitation and have the conversation with your veterinarian about your concerns. Veterinarians want to hear the small stuff. Let go of the fear of overreacting. They would prefer to hear about 10 things that are nothing than miss the one thing that matters. Tell them about changes in grooming, any groaning sounds, litter box near misses, or new routes your cat takes. None of it is too small. It is all crucial data. Finally, consider the schedule of your cat's veterinary visits, especially as they age. Cats aged 7 and older are considered seniors, and once-yearly visits are not enough. They need twice-yearly exams, every 6 months. Senior wellness panels, including blood work and blood pressure checks, can catch conditions like kidney disease or diabetes at a manageable stage before significant damage occurs. Remember the weight of your responsibility. You are the only advocate your cat will ever have. Your cat cannot call a doctor or describe its pain. You have the time and the ability to look at your cat differently, with calibrated eyes. Trust that small, uncertain feeling. Call your vet, describe what you've observed, and ask. That question is the bridge to finding, treating, and stopping suffering.